Dr. Kate Tulenko joins me now from just outside Washington. She's the founder and CEO of Corvus Health. Doctor, thank you so much for joining us today. So many questions for you as this virus is evolving. Originally, it seemed the cases were mostly confined to men who have sex with men. And now, as this story just alluded to, they've now spread beyond that specific group. So are we likely to see this trend continuing of this virus spreading in the general population?
Yes, I think we will, especially as school returns in the next few weeks. I think college students are particularly at risk because this is a group that lives communally in dorms, goes to large classes together and also, frankly, has sex together. So I think we really can expect the outbreak to grow with return to college. And as far as, people protecting themselves, really anything you would do to protect yourself from COVID will protect you from monkeypox. So K through 12 students, they don't need to necessarily wear masks, although monkeypox can be spread respiratorily, but cleaning services, encouraging them not to, touch their nose, eyes, and face, that type of thing will help keep kids safe.
Well, the U.S. now has the most monkeypox cases in the world, and it's struggling to meet demand. The strategy currently is to split these doses, trying to squeeze 5 doses out of 1. I mean, talk about, does this affect the effectiveness of the vaccine, and has this been done before with other diseases in the past?
It has been done with some diseases in the past, and my opinion is that it will work. That instead of giving a larger dose in the fat below the skin with a larger needle, they're going to give a 1/5 of a dose immediately below the skin, and this is actually a much easier injection to give. The smallpox vaccine, which is the monkeypox vaccine, really creates a quite strong immune response, and so most likely we will see that this vaccine is effective even in a 1/5 dose.
And also, the way that the vaccine is administered, what about the logistics of training people to do it this way?
I'm not very concerned about that. I mean, because it's really a very simple change in the type of needle and the amount that you draw and how you inject it. And most people who are injecting are physicians, nurses, pharmacists, and they're very experienced with giving an injection. So it shouldn't be that difficult for them to be trained.
The symptoms we've been hearing about are rashes, but have we heard about any serious symptoms beyond that? Have there been any fatalities or critical cases?
Well, certainly globally, we have started to see fatalities outside of Africa, and this tends to be in people with chronic diseases. And what tends to kill them is they have problems with their lungs because it is indeed a respiratory disease, or they can have organ failure. We do have effective treatments, and that's been a challenge now getting the treatments to everyone, both people who have sort of regular cases as well as people who have critical cases.
As you know, the Centers for Disease Control and Prevention has faced some criticism for its slow reaction to monkeypox as these early cases started emerging. Do you think more could have been done early on, given the same experience the agency had facing the COVID pandemic?
Yes, there are a number of challenges even this time around with monkeypox. The CDC let 20 million monkeypox vaccine doses expire in the national stockpile. There were delays in ordering more. There were also delays in getting the testing kits out, delays in getting the treatment out. Also, mistakes were made in the case definition and also in determining who should be tested.
Dr. Kate Tulenko with Corvus Health, thank you so much for breaking this all down for us.